Aster Media Awards, we seek to honor not just a set of journalists, but the whole media fraternity that extends support and resources to the society.
Across the world, the greatest catalyst for change has a common name: journalism. We are here today to celebrate success stories of journalists. Ladies and gentlemen, a warm welcome to first Aster Media Awards. For the auspicious lamp lighting ceremony, I'd like to request our guest of honor, Professor Kurien, Deputy Chairman, Rajya Sabha Government of India, Shri Venu Rajamani, Secretary to the President of India, Padma Shri Dr. Asad Mupin. We'd like to welcome on stage Shri Kuldeep Nayarji. What an honor, sir, that you could join us this evening.
For us, this is a great occasion. It's a dream come true. This is something which actually started as a spark when something happened about 2.5 years back in Dubai. This whole idea came when one of the senior journalists, who was the editor of one of the newspapers in Sharjah, Gulf Today, Mr. Anand, died suddenly. And at that point, we realized that the stress, the strain, and the intense pressure, both from inside and outside, that the journalists are undergoing, is something which should make people like us, especially people who are into healthcare industry, to consider doing something for them, recognizing them. We thought that we should institute to celebrate the actions, activities, and provide a platform for continuing that for a long time. And that's how we started this Aster Media Awards.
Hope is being able to see that there is light despite all of the darkness. It is this hope that inspires Aster DM Foundation and Dr. Mupin Family Foundation, the two charitable arms of Dr. Mupin's foundation that supports programs that address underserved and marginalized populations. These programs become meaningful when we see the light in these young eyes and the new lease of life that enlivens their nimble limbs. The Special Needs School, launched in 2009 for differently able children, provides the best of facilities to its students. The Rural Health Center, started in a very backward area called Wayur, Karad, is an epitome of the Foundation's commitment to help the poor. Life-saving surgeries and procedures are done for patients from families who cannot afford advanced treatment, including complex surgeries. All the services are provided free for the economically marginalized people or at a highly subsidized rate, bringing hope and bridging gap among more families and regions. Care beyond boundaries.
So moving forward, we have a very special video message from Shri J.P. Nadda ji, Honorable Minister for Health and Family Welfare, Government of India.
The current function is a great step to ensure that the fourth pillar of our civil society remains committed to reporting on various areas of social impact. Journalism has an ability to impact public policy and the politics of a country. So I congratulate the recipients of the Aster Media Awards 2016 for their invaluable contribution towards this. I hope more journalists will take part in this mission in the upcoming years and will play a role in bringing social change through their reporting.
These are the Aster Media Awards, and a lot of journalists are here. They will be awarded for what they have done. One of the major questions that any young journalist has when he's entering the profession is, how can I make an impact? How can I do something positive? How can I make a change in society? So what is it that the message that you would like to give journalists? How do you think they can actually make a positive impact?
The first thing I would like to say is that the impact of media, when we consider, is maximum and more than any other sector of the society. Impact is maximum, number one. Second point I would like to say, yes, according to me, in my view, is that it is for the media to consider when they say something, when they write something, to consider what is the impact of what they are doing, what they are writing. Yes, no doubt we want honest reporting. Honest reporting. But we should also think what is the impact of what we are writing. Are we thinking of that? The other day I saw on a TV channel that the TV channel was saying that, see, this is a particular government has taken some steps, some good steps, positive steps, and this is the impact of our news. But are they thinking what is the impact of other news that they are doing? For every news, there is an impact. In fact, journalism, according to me, is not just a job, just a profession. Journalism should be considered as a mission.
But if I can turn to Amitabh Kant, I think Professor Kurien very correctly said this is what should be done and this is what journalists should aspire to. Unfortunately, if you are to take the condition of a lot of journalism today, and especially in the electronic media, I'll have to say, that's something which I myself belong to, it is a bit of a disappointment because you're not necessarily always seeing those lofty ideals being borne out in practice. You're actually seeing a lot of tabloid journalism, you're seeing a lot of sensationalism, you're seeing a lot of hysteria, you're seeing a lot of shouting and screaming, and you're seeing very little social impact, very little positive change. But do you agree that the quality of news can be better and that somehow we have to try and find a way of moving journalism back to the lofty ideals that Professor Kurien was talking about?
We are growing at about 7.5%. We need to grow at even higher rates over a 3-decade period as a country. The challenges are enormous, especially in social sectors of health, education, nutrition. A country can't grow at those rates unless and until we are able to address all these issues. I mean, how can a country grow rapidly when you're passing through your window of demographic transition and 39% of the people are impacted by nutrition issues? How can you grow at those rates when class 5 education, kids in class 5 are not able to do addition, subtraction of class 2, or you are not able to read your mother tongue in class 2? These issues are just not brought out. And there's a lot of good happening across India. There's a range of best practices happening. None of them are highlighted. I mean, the electronic media is over-obsessed with TRP. To my mind, the methodology of TRP is flawed. It doesn't capture the vast number of viewers in the villages of India. It captures a very elite urban class. It captures only Vikram, you, Mr.
No,
Kurien,
actually it doesn't. It doesn't capture people because there are no people meters in your house or his house or my house or anybody in the room. So it captures a set of people who like tabloid content and who like sensationalism. That's the problem.
So
Dr. Mubin, you must be also slightly concerned about the fact that you're not necessarily accepting in pockets, seeing the quality of journalism that ideally we should all be aspiring to.
If you look at certain things, for example, the fight against lung cancer and smoking has been mostly by media, much more than by medical profession, which became a great success in the US earlier and even here now. And there are other stories like HIV, or even if you look at the consumption of sweetened liquids and all these things, you find that there is actually awareness which might have saved millions of lives and is likely to save millions of lives. And there is actually a very definite role which the media can play positively, which may not have the TRP effect. So if there is a focus, and if there is really it is put forth to the people, I think people will accept that, and that will also take the media which is promoting that to a higher level.
All right, well, thank you all so much for joining us, because the rest of the evening is going to be spent in honoring a lot of the people who went beyond this, who went beyond the TRPs and the other issues and actually were able to make a major social impact. So thank you all so much for joining us.
I'd like to request our guest of honor, Professor Kurien, to please join us on stage, sir. Our audience has been looking forward to hearing from you.
Journalists should be committed to the nation. Yes, they should give honest reporting, they should write honest report. At the same time, they are just not professionals, or they are just not employees, but they are holding a mission. The journalism profession is nothing but a vocation where you have to work in a mission mode. You have to know whatever you do has an impact on the society, either positive impact or negative impact. And today I know, see, if you look at and read the newspapers, you will see whatever is bizarre and whatever is abnormal, that all will be reported. So many good things are also there. They are not adequately reported. Media is a fourth pillar of democracy. As legislature, as executives, as judiciary, these three have a responsibility in protecting the democracy. I would say media has a greater responsibility in protecting the democracy. Therefore, it is time for the media to introspect. And this award constituted by Asad Moopen is meant for that also. He wants to encourage genuine, committed journalists. So I congratulate Asad Moopen for instituting this award.
Thanks for sharing those encouraging words. Let's put our hands together.
My belief always has been that if India is to develop rapidly at high rates, if our objective is to grow at 9 to 10% over a 3-decade period, 72% of our population is below the age of 32, and you need, if India is to grow at those rates, you need a huge transformation in the social sector. It will be very difficult for India to grow at those rates unless and until we don't transform our health and education sector. And my belief is that while the southern part of India and the western part of India is doing extremely well in several of these indices, the northern part of India, particularly 6 states, are taking India backwards. And therefore there is a need to create a unique, healthy competition among states and put it in public domain year after year, year after year. The other key challenge to my mind is that our allocation for health, while it's low, but if you combine it with private sector investments in the health sector, it becomes quite a high amount. But the efficiency of our delivery is very poor in the public sector. And therefore you need to improve the quality of delivery in the public sector and enable India to achieve a much better record. And the fourth point to my mind, which is very critical, is that you have a vast number of people who slip back into poverty simply because the expenditure on health, the out-of-pocket expenditure on health, particularly for tertiary care, is very high in India. And therefore, you need a very good health insurance scheme which will enable India, particularly on areas of heart attack, cancer, etc. The expenditure is enormously high for people. And therefore, you need the state to play a very major role in creating a very innovative health insurance scheme. There are very few people, very few doctors like Dr. Moopen who create wealth in society and then try and spread that use their wealth for spreading awareness for a better class of people. And there's nothing better than recognizing the good work done by the media in the field of social sectors, particularly education and health.
It's truly with great happiness that I stand before you today to present the winners of the first edition of the Aster Media Awards.
Well, our jury surely had a very, very tough time going through the entries, and they've come to the decision. To tell us more about this, let us put our hands together as I welcome on stage Mr. Venu Rajamani, Chair of the Jury Process.
It's truly with great happiness that I stand before you today to present the winners of the first edition of the Aster Media Awards. I congratulate and thank Dr. Asad and the Aster DM Foundation for having instituted these awards, and would like to say how privileged I feel to have been invited to chair the jury for selecting these awards. The purpose of the awards has been, I think, repeatedly mentioned this evening. The key and absolutely essential criteria was social impact of the stories. What change did they make in society? We were given a broad rubric: international, India, and Kerala. We were asked to choose 3 awardees, 1 award each in each category. And considering the quality of applications we received, the jury just threw up its hands and said, sorry, this is impossible. So we have ended up choosing 1 winner in the Kerala category, 2 winners in the international category. There's a joint winner, so both were equally good, and 2 winners in the general India category. And to add, because once again, because of an outstanding submission, we decided that there should be special mention of 1 particular article. There is a fear amongst many that journalism, as it was known, is dying, if not already dead. There is much talk about political bias in reporting, which makes the average viewer or reader difficult to understand whose agenda is being promoted by whom. There is talk about managements getting rid of editors completely and running publications and television channels in pursuit of their business interests. There is a mood of intolerance in many parts of our country and the world, where dissent of any kind is stifled. It becomes extremely difficult for journalists to practice their profession without fear of their life and their security. We have also heard of paid news. We have heard of sensationalism. We have heard about tabloidization. In these gloomy times, these journalists who have written these wonderful articles bring a whiff of fresh air. They bring us faith and they bring us hope, both in the media as well as in our society at large. Friends, a strong and vibrant media is the bedrock of any democratic society. Today, as we celebrate the success of these winners, along with them, we celebrate the victory of free speech, the victory of quality journalism, and the conviction that the media can be a powerful tool to produce social change for the better.
The the Aster Media Awards. It's been a pleasure to be a jury member on the launch of the Aster Media Awards. As a jury member, together with my colleagues, we looked for social impact, we looked for good quality journalism, we looked for relevance in this day and age, whether it's print, digital or broadcast, and there were some excellent submissions. Not everybody can be a winner, but actually everybody was a winner. It's been an absolute pleasure.
Well, it's been great to be part of a jury which had a long discussion and a deep discussion, because the kind of entries that we had were just amazing. Very in-depth, very socially relevant, and which was one of the key things that we were looking at, the impact of the stories. It was a testy time. Some of the stories were very good.
I must thank and compliment Aster for initiating this media award, because it means a lot. This is the first of its kind, and it recognizes a special kind of journalism. The process followed was quite rigorous. 3-4 basic criteria for shortlisting the stories. One is relevance, of course. How is it relevant to our present-day society, to the world that we live in? Second is, does it have an impact? Does it really send out waves and ripples, and therefore, impact people? People, not just anybody, but wider sections of society. Quality of journalism, whether it was print journalism or television, quality was very important. Whether it was, whether the story was told well, whether it was written well, and in a way that had maximum impact. So these were some of the criteria on which these stories were decided.
I would like to begin by congratulating the Aster DM Healthcare and its chairman, Dr. Asad for having instituted the Aster Media Awards. What makes the Aster Media Awards special is, one, the very significant prize money, which is perhaps, at least in India, the highest for any journalist award. And second, the fact that it seeks to link the Gulf region and journalism in the Gulf region with, and the Gulf region is special because there's a large Indian community which lives there, along with the journalists in India, and then also have a regional focus on Kerala, which is known for its vibrant journalism and which is from where Dr. Moopen comes. So I think this is an outstanding initiative to establish these media awards. In today's world, nobody can function without a good, vibrant media present within their society. It is extremely important that we give journalists and the media in general every support possible. We recognize those who do outstanding work amongst them, and we honor and show appreciation for those who have truly created a mark for themselves through their stories, through their writings, through their reportage.
When we broadcasted this issue on Manorama News, from all over the world, help came to this particular family. Kerala government itself opened their eyes. This award, I think people may be remembering once again about this particular family. Governments and social system may be vigilant on preventing such things happening once again.
Many congratulations as we get set to present the Aster Media Award Regional Category Kerala, and the award goes to Sinoj Thomas.
I am very happy to be here because I am just a beginner in this field of professional journalism, and receiving such a biggest award in the nation will be an inspiration for me to work hard and to do such a social impactful stories in the future. So I thank Aster DM Foundation for conducting wonderful event here and being part with their social responsibility. And thanking all of you for gathering here. Thank you all.
Many, many congratulations to you once again, Sinoj. And we look forward to seeing more such stories from you.
As a journalist, I have always believed that my primary duties are to inform, inspire and empower. And in this series, I believe I could do all that.
Let's put our hands together as I invite on stage Sajila Sasheedharan. Ladies and gentlemen, the Aster Media Award, international category.
So I hope this will inspire more journalists from India and in the Gulf countries to do more socially impactful stories, come up with reports that will impact the stories, impact the society in a positive way. I'd also like to share this joy by sharing a portion of my cash prize to the distressed Indian workers in the UAE. As you might have heard, my report was for them. I wrote about them. I'd also like to contribute for their something for them through the Indian Community Welfare Fund of the Indian Embassy in Abu Dhabi. I'd also like to support at least one journalism student's higher education, and I've already found out one from the financially weak family in India. I hope that way I can contribute to the rise of at least one more journalist who will contribute to socially responsible journalism. It's been a great evening. We'll never forget this. This is indeed an Oscar night for me. Thank you so much.
Many, many congratulations, Sajila. You truly deserve it, and what a noble thought that you'd like to share this winning amount. Thank you so very much.
Thank you so much for this honor. It's truly humbling.
Inspired me to do this feature. There were three things really. This one, it dealt with education. Two, it dealt with education of the girl child. And three, it was a model which could be replicated anywhere across India.
The Aster Media Award, international category winner. Let's put our hands together for Anand Raj. Many, many congratulations.
I'd like to just take 2 minutes and say thanks to God, thanks to my family, thanks to my team who really worked also with me to put the story together in the magazine.
So I think it's a great initiative, and I'd like to congratulate Aster Media for coming up with such a noble idea.
The Aster Media Award National Category. Let's put our hands together as Sarika Malhotra takes the walk of fame. Ladies and gentlemen, amongst fanfare and your applauses.
Thank you so much for this honor. It's truly humbling. I would like to compliment Aster DM Foundation for this unique initiative, and I wish them all success.
Thank you so very much, and many, many congratulations.
Media Award is a very good initiative by the Aster DM Foundation to identify, support and promote excellence in journalism. I'm sure that in the years to come, this will be one of the most sought after awards, media awards in the country.
Let us put our hands together for Manoj Sharma. Glory is all yours, Manoj. Many, many congratulations. The Aster Media Award National Category winner.
Good evening, everybody. I'm really honored to receive this award this evening. And let me confess, I was under a lot of pressure to win a journalism award. My wife has won quite a few, and my daughter who is sitting there, she used to ask me, Dad, what is happening? Why are you winning any award? It so happened, it was a sheer coincidence that in April I got a call from the DM Foundation that you have won this award. And we were in Mumbai where my wife had won yet another award. So in the morning she asked me this question, and in the evening I was able to answer her question. I've done it finally.
Many congratulations. Thank you so very much.
And I'm sure that this award will encourage journalists to write stories about the people living on the margin. 10 lakhs is a lot of money for journalists, let me confess.
I believe they're doing a great job bringing to life some of the unknown facets of India. And as a feature journalist, I believe India is full of such positive stories. So if they're bringing to light some positive news into the realm of mainstream media, which is a good thing, and by appreciating such stories, they're doing a good job.
Let us put our hands together for Asheesh Sharma. Truly deserve to be here.
Thanks so much for the Aster Media Foundation, because mostly feature journalists don't feature in award-winning categories per se. So the jury has to be complimented for looking beyond the surface and actually looking at a story which was a weekend story, and it was about rural India. It's one unlikely kind of a winner here. So you actually looked hard through entries, and you must be complimented for that.
So the evening will be incomplete if we don't thank all our jury members. Of course, together. Let's have one picture with all your brilliant smiles. So may I request all winners to join us on stage? We used to call journalists Qalam ke Sipahi. So here is a Qalam ka Sipahi which
wins the wars with the pen in hand. So 3 cheers for all the journalists.
All right. We have 5 panelists out here. I'm not sure where to start. So because there's a lady out here, I will have to start with you, ma'am, unfortunately or fortunately. I think the first question that we wanted to talk about was the scrutiny that the media itself should have on itself. And what I wanted to understand from you is that is the media actually doing enough right now talking about health or not?
Dr. Asad has a symbol here, a logo, an emblem, and this is the emblem of the awards. And we, Kuldeep Bhai would know, I'm sure he's one of the authors, we used to call journalists Kalam ke Sipahi. So here is a Kalam ka Sipahi which wins the wars with the pen in hand. So 3 cheers for all the journalists in this room. Media पे बहुत criticism है. Electronic media पे, digital media पे, print media पे. But I would like to suggest that media is doing its job with exception, and I'm still the old school. I still read the newspaper more than I watch the visual, the television. Media is doing a responsible job because we find them going into the gullies and the mohallas and the far-off areas and the Koraputs and the Bolangires and the Kalahandis and the Mewat and all the areas, and especially I want to say that, Dr. Azad has set up a hospital in Idiki. So I think it is the inclusiveness that media is becoming more sensitive to.
But as we talk about the media, the one person we can't ignore out here is Mr. Venu Rajamani, Press Secretary to the President of India. You heard what ma'am said. I want to take it further because she said it's happening, but again, enough is the big question. Television and print specifically.
Well, I think today in any discussion on media, it should be television, print, and digital. All 3 are very important factors. But let me say that media has an integral role to play in virtually every aspect of healthcare. That must be recognized, that must be understood. Media has a key role to play in prevention, in educating people about sanitation, in educating people about hygiene, what to do, what not to do. Media has to have a very key role to play in pointing out deficiencies where they exist within the healthcare system, where exploitation exists, where existing systems do not reach the people for whom it is meant to reach. Media has a very key role to play in highlighting success stories, in spreading word wherever there is a good story of achievement in the field of healthcare sector. So media needs to do more, but equally people involved in the health sector must keep the media close to themselves. I compliment Dr. Asad for creating these awards because this is a wonderful example of a medical group using its CSR to reach out to the media, to reward and to recognize the media. So we need people in the health sector to keep media people close to them, to keep media professionals close to them, and to put out as much information as they can to see media as a force multiplier and an ally rather than an enemy.
Specifically, if I could come to Dr. M.C. Mishra, Director of the All India Institute of Medical Sciences. Sir, if we could specifically speak about the scrutiny that you as AIIMS, as the flagship hospital of the country, gets very frequently, and also kind of link that with an action point where you think the media can actually make an impact, and we could leave that as a suggestion for the people out here.
No, as I think everybody else has said, that media, whether it's electronic, print, or digital, is a very powerful medium to disseminate whether it's a positive story or a negative story. So it both ways it works. I have more positive side of media with me than negative side. They do negative stories, and I don't blame them. Unless we bring out deficiency, how are we going to improve? So scrutiny has to be there.
If I could come to you, Professor Ramanan, you have spent a lot of time in America, I believe. When we talk about the media and we talk about how they have, for example, imbibed the qualities of journalism to have a positive impact on health, if they have, you can stress on that. how is it that we can do something like that? What would be your action point?
I don't think the Indian media wants to learn from the American media. I don't think that's advisable at all. I think we have a good thing going here. But I think what is helpful to know is there's history here, and there's a broader story, and the media is good at telling stories. If you really look at, say, 600 years from now, you look at the history of our country post-independence, there are lots of things that you might tell and things that you might forget. But the one thing that will be a story will be the fact that from, say, the time that, that Mr. Kuldeep Nair was born, right up to now, when he was born, and I just looked it up, life expectancy in this country was 28. Today, it is 67. There's more than doubling of life expectancy. I mean, if life expectancy was 28, none of us would actually be on average be on stage right now. It came about because we reduced infant mortality. It's because we improved in many ways diarrheal disease, we improved vaccination, and these were powerful, large picture stories that really created what happens today. And these are the things that will also produce change going forward. No doubt, you know, if someone is sick, healthcare is important, and picking up those stories and running with it is very important. But where is the media when it comes to the fact that Mission Indradhanush has just in the last year improved immunization coverage in this country by 5 percentage points? Does anyone in this audience know that the number of children in this country who were fully immunized for the first time in just the last year was more than any other country in the history of mankind? Right, just in this last year.
Yeah. See, the most important thing that I find is that there is a huge requirement for us to focus on primary health care. See, we have been focusing on this earlier in some states at least, like Kerala, for example, whereas later somehow things started skipping. We started focusing on more on multi-specialty hospitals, more in the urban areas. So there is a requirement by the government for us to focus on the primary care rather than looking at other areas. And of course, that requires a lot of investment into medical education, as has been told here, and increasing the number of availability of medical personnel. So that's a very, very important thing, which definitely will produce a huge impact, especially in the states which are now far below when compared to the indices, when compared to the southern states. As he rightly mentioned, we are far below in those indices in the northern states when compared to the southern states. This has come due to this focus on the primary care, and this has to happen through technology now. That's the most important thing. In the next 2 or 3 years or 5 years even, we could have a transformation in healthcare technology which could go to the people, to their doorsteps, to their handheld devices.
Okay, so the takeaway is technology has a huge role to play in this.
Sure.
I want to understand the success of government schemes specifically for better healthcare outcomes.
So government schemes are difficult in general to engineer from Delhi for a country of the size of India, 1.25 billion. There are schemes that are with vertical programs, things like delivery of vaccines that can work at a national level. Even here, it's extremely difficult because it's such a diverse country. We're actually seeing two Indias, the Indias which have access to good public health.
Why is that happening?
Well, it's the same as with income. It's with everything else. We are, the within-country inequality in access to health care is growing because the average person in rural Bihar or Jharkhand doesn't have nearly the quality of care as you would get in rural Kerala. You can go to rural Kerala and you can be within 10 minutes of a
So then it's the other stakeholders that are not connected, for example, education, for example. That is what could probably help health.
Most of health is actually not determined within the healthcare sector. Most of health is determined by literacy. Maternal education determines health to a far greater extent than anything else. So when all of these are deviating, the simple presence of having just a hospital or even in some instances a doctor is not going to make the change in health outcomes that we really care about.
All right, all right. Yes, ma'am. Please take
I just like that point so much. क्योंकि हम लोग पिछले 15-17 साल से social determinants of health की बात कर रहे हैं. So you empower the women, you educate the women, and immediately the health indicators go way up.
Right. So thank you so much for this discussion. It is, if nothing else, completely enlightened me in the world of health.